And now, Wellness Wednesday, brought to you by Express Care Urgent Care Centers, a LifeBridge health partner.
Well, it is Wellness Wednesday, and we are talking about virtual urgent care.
So Dr. Jonathan Thierman, president of Express Care and Emergency Department physician, joins us. He's back with us this morning. Hello.
Hi, how are you guys?
We're doing well, thank you. Always well on a Wellness Wednesday when you come to see us.
Yep.
So tell us, the virtual care seemed to really kick off during COVID when people couldn't get to doctor's offices and everybody was logging in on Zoom. It seems to have maintained and seems to be taking off.
Yeah, it's becoming really popular. It existed beforehand, but of course COVID made everyone need it and use it, and since then it's kind of stuck. It's been convenient for people and a great way to get care.
And so what sorts of things can you get checked out on, like via a telehealth situation like that? I imagine not everything.
Yeah, it's mainly for low acuity things. I mean, we're in urgent care, so we already do things that are a little lower acuity than the ER, of course, but then this is stuff that's maybe more simple, straightforward, and then also stuff that's highly visual, so pink eye, rashes, sore throats, things you can see and diagnose visually is predominantly what we use it for.
I was going to ask you that. It's like we've been talking about these allergies. I have one eye that has been tearing for a solid week, and everybody else in here is rubbing that one eye or something.
Yeah.
That's the kind of thing that you could actually say, hey, look, doc, this is what's going on, and put your eyeball in the camera.
Yep, exactly right.
Okay.
And what would you say to people who are maybe worried that they won't get the same sort of care or won't get checked out as thoroughly virtually versus sort of in person?
Yeah, absolutely. I mean, we actually put some of our best PAs at Express Care and NPs on the, and doctors as well, on the telemedicine platform, because we want them to be able to decipher who needs to come in and who can get seen appropriately. So most of the people that we have on telehealth were former emergency medicine providers, and so they kind of triage, if you will.
Okay.
And the nice thing about Express Care is that we also have in person, and we have a network of a system, so we can kind of basically send you where you need to go if it's not appropriate to be seen by telemedicine.
Okay. Now, are there times you suggest the telemedicine versus the coming in? Does it make it simpler, or what is the criteria?
Yeah, I mean, it's basically best when we get really busy, because the wait times obviously are going to be less, and it's going to be more convenient at home. Sometimes people, if they're having a lot of nausea, or they're just feeling under the weather so bad that they don't want to make the trip in, it's also a good time to do telemedicine.
And what's the process of booking an appointment, and how last minute could you do it if you wanted to?
It's almost like walk-in. You can do it pretty last minute. We have tons of slots. We see a lot of people every day, but we have a lot of providers doing it. So you book it the same way you would book an online appointment through our website, goexpresscare.com.
Okay. I know there's some patients, and I know I have some older patients in my family and relatives who just are leery about the technology of it all. They just feel like, they don't know how to do it. Kind of walk us through what would happen.
Yeah, sure. So in our situation, you would sign up online like you would for an appointment, and then you'd be sent a link. And it basically works from any phone, iPad, computer, and the link would pop open your Zoom-like window, and you would just go from there. We also have people that would call you if there's a technical problem to help you get set up. But we actually, surprisingly, I was surprised when we started really ramping up that a lot of elderly people actually find it useful and convenient, because they have some mobility issues, and the technology is not really limiting for them.
That's great. Okay.
Thank you so much, Dr. Thierman. We appreciate you joining us on this Wellness Wednesday.
Nice to be here. Thanks.
Absolutely. Thank you.
Okay.
Wellness Wednesday on WJZ at 9 is brought to you by Express Care Urgent Care Centers, a LifeBridge health partner.